Hey, welcome to the second podcast of the Challenge of Therapy.
Yeah.
I'm Dr. Christine Schneider.
I'm Dr. Elizabeth Irwin.
And we're here today to talk about this pressing question of why do we not diagnose rage?
Why don't we diagnose rage? Is it the patriarchy?
I'm sure it is. That's probably where we're going to end up, right? Yeah. And in defense of that argument, I've been around long enough to know, I can't remember if it was the DSM-3 or 4, but there were basically two potential diagnoses in this. One was Batterer syndrome.
Yeah.
Looking at mainly men who rage out, and the other was premenstrual dysphoric disorder. Guess which one stuck? And I think there were two reasons for that. Back then, the DSM committee was almost exclusively white men. Luckily, that's changed. But also, there was a medication to treat premenstrual dysphoric disorder.
Right.
We have no medication for rage.
Yeah.
Right?
Yeah.
And so before we get too much in the weeds about this, we're going to talk about what is rage, how does it differ from anger, and what is the impact of not diagnosing rage. But to start off with, what do you see as the difference between anger and rage?
Well, I like anger. I'm a big supporter of anger and helping people identify and accept their anger. And the constant joke that I have is that every morning I wake up and I'm a little angry that I'm not independently wealthy, right?
Like, as we all might be.
Right. And I'm angry that my butler hasn't greeted me with my coffee in the morning, right? And being able to, I think, have that anger and be aware of that anger is one thing. And what do I do with it? I make a joke about it, right? Because it would be absurd for me to demand this. I don't even know who I would yell at about that, right? But I think the distinction between a felt sense of an emotion, this being able to be aware of that and decide what you do with that, versus rage, which feels like it now, the emotion has taken on a life of its own and it's driving the individual in a very impulsive way.
Yeah, because I agree with you. I think anger is the wisest of all emotions. Mm-hmm. And unless it's about having a butler, sometimes it's about this relationship feels disrespectful to me.
Right.
Or I feel overwhelmed. I feel like somebody's expecting too much of me. And the point of anger is to push things away and support your integrity. Right?
Yeah.
But again, you need to be able to respond to that and not be in a reactive state that rage puts you in.
Yeah.
And I think the difference between anger sort of pushing people away and creating space versus rage, which I think says, I've been hurt and I need to hurt the other.
Mm-hmm.
Right?
Right.
And my definition of rage through sort of years of experience is that, see what you think about this, is rage equals anger plus helplessness plus entitlement.
Okay.
So, I tend to say to clients that rage is impotent, right?
Right.
We don't go to war with countries we can negotiate with.
Right.
So anytime somebody's raging,
right,
I think there's a lack of control and there's a huge sense of helplessness and maybe codependency.
Okay.
Right? And so when we're thinking about this, rage tends to have a fragility in it.
Yeah.
Right? That we don't really acknowledge.
Yeah.
But rage is also exceptionally destructive.
Yes.
Right?
Yeah.
And actually the reason I started thinking about rage and really trying to figure out why we don't have a diagnosis for it, several years ago I was listening to an interview with a psychiatrist and she was saying, let's say that a potential school shooter showed up in my office and said, I'm going to shoot up a school tomorrow.
Right.
Now, I'm of course going to try to involuntary that person because I need to keep them safe, right? And they would meet criteria for an involuntary because they're an imminent risk to others.
Yeah.
But I may have to make up a diagnosis because maybe they have depression, maybe they don't. Maybe they have, a personality disorder. Maybe they don't. But there's no diagnosis for rage, is there?
Yeah. Yeah. There is some would say that there is, right? Like before you turn 18.
True, right? Oppositional defiant disorder.
Right.
Right.
Or conduct disorder?
Right, but conduct disorder is different, right? I mean, conduct disorder may have rage, but we also have all these antisocial tendencies. We're torturing animals, and I shouldn't say we're torturing animals.
Right.
They're torturing animals and starting fires. And somebody who rages out wouldn't necessarily do that.
It's an important distinction, right? It's the distinction between the behavior, the rage behavior, being somewhat, right, ego dystonic, right? Like somewhat
Yes. Having some remorse afterwards.
Yes, like when I'm outside of the rage, even if my ego doesn't quite let me acknowledge the destruction, I know I don't want to get back there.
Right.
And yeah, I think that when we think of more antisocial, it seems like there isn't remorse.
Yeah. And of course, conduct disorder becomes antisocial. What does ODD become at 18?
Do you just become an asshole?
I think so, right? I think as a society, we've just decided to adjudicate these people.
Yeah.
Right? And the idea that we're not having a diagnosis around this is a little terrifying, right? But I think the counter argument to this is like, well, don't people have the right to have their emotions?
And I guess I would be curious about the distinction between when it's an emotion that we just have the right to have and makes sense in the environment versus when it feels like a diagnosable pathology.
Yeah, I mean, I reserve the right to rage.
Right.
Like, I'll give an example. When I raged out, and I still feel incredibly justified of raging. I'm walking to a happy hour down kind of a dark alley with a friend who still hasn't forgiven me for this. And somebody comes running up behind us. I can hear them aggressively running towards us. And she screeched.
Yeah.
And I think we both decided, like, this person's here to rob us.
Yeah.
And I turned around and raged out at them.
Yeah, what'd you do?
I lunged at them. I screamed at them. I just went after them.
Yeah.
Right? And I saw a hand in a pocket of what looked like a gun. And they ran away.
Wow.
Right? So my rage was really powerful. I felt like there was a life threat against me. I stand by that rage.
Yeah.
I'm not saying rage is always bad, but there is precedent for diagnosing emotions that go awry. Right? Sadness. It's great to be sad. It pulls people in. It allows us to grieve. It allows us to get rid of some emotions. But you're sad in a way that's maladaptive, and we call it major depression, right? Anxiety. Without anxiety, we all go walking into traffic. Anxiety is unbelievably adaptive until it's not.
Right.
And then we start diagnosing generalized anxiety disorder. We diagnose maybe specific phobias or panic attacks. And why isn't it the same with anger and rage?
Right.
Why isn't it that, of course, we all get to be angry, and rage can be the appropriate thing sometimes.
Right.
But why isn't there a line that we draw that says too much, it's maladaptive?
Both for the individual and for the society they live in.
Right.
Yeah.
Yeah. I mean, if you look at the amount of death and destruction, I would say rage far exceeds depression or anxiety. And yet, as a society, we're sort of deciding this is okay.
Yeah.
Right?
Yeah.
And what do you think the impact is of us not having a disorder around this?
Well, I guess I think that, if we continue to not create an avenue for help, right? An avenue to say, let's support developing mental health workers and being able to figure out how to confront, be able to identify interventions to use, be able to identify ways to assess growth, right? If we don't come up with treatment plans and models around this, then we're dropping the ball on the people struggling with rage.
Yeah.
And then also for the individuals that are suffering from rage and their families and their loved ones, there's not an avenue towards, it's so vulnerable to admit to yourself and to others that you have enacted violence or you have hurt other people.
Right.
And if we as a community, as a mental health community, are able to say, no, we see this, we identify this as something that needs help and support, and we're actively working on this, the likelihood of people being more willing to seek help could increase quite a bit.
Yeah, and even, you and I both teach classes, right? And we both teach in the graduate school now, but I've taught in community colleges, I've taught in undergraduate, and I've had the student there that was seething with rage.
Yeah.
Right?
Yeah.
And I would often lead my class through this experience of, like, let's say you have a student who's pacing back and forth at the back of the class and scaring everybody. What do you guys do? And they're like, well, maybe I'd stop going to class, maybe whatever, right? Okay, let's say they're drawing but could we do anything to intervene? Well, no, they're just, right? Let's say they drew a picture of people with blood on them. Well, it's just expression, right? And all of these things that denote rage. But what we would end up saying is, I'd ask them, right, so if that person came in and shot up the school, what would we all be saying the next day?
Saw it coming.
Saw it coming. We don't even have to ask who it was.
Right.
And yet we have no disorder, no like psychological gap to come in and say, this isn't okay, this is the disorder.
There are degrees too here, right? Like there are degrees of somebody shooting up the school versus somebody just continuing to lose a job because they right? And I think so often the impact of not having the diagnosis means that, like, they're continuing to have these violent fantasies or continuing to draw these violent pictures, like, and they're so afraid of showing anybody because it's maybe outside of their integrity, but also they're terrified that they're a bad person, right?
Well, and when they do, and sometimes they do leave it out to try to get caught.
Yes.
But it's still, there's no language for it. There's no like, oh, you've heard of this rage disorder, this is what you have.
Yes.
There's no language, right? And on the other side, on the victim side, there's no language to say, this isn't okay.
Exactly.
And this isn't about me.
Yes.
Right?
Yes.
If an alcoholic or somebody who's substance abuse gets really drunk and acts out, they may come in and say, well, they're drunk. Right?
Right.
But there's not a rage diagnosis to say, hey, they're raging.
Right. Right.
Right.
Well, yeah. Well put. That that having this diagnosis wouldn't only help the individuals who are suffering from it, but it would also help others who are perpetrated by the diagnosis be able to identify it and spot it and say, nope, not my problem.
Yeah. I think the cynical part of me would say the reason it's not a diagnosis is because people in power feel the right to it.
Yes.
I mean, just imagine the political world. If rage was a diagnosis that we called out versus an entitlement that some people feel entitled to.
Yeah, that gives me goosebumps. Like, if we could diagnose people in power with rage, like there was a pathology.
Yeah.
Right? Yeah.
Yeah. And so, as usual, I think this podcast asks more questions than it answers. Right. But I think it's a fascinating conversation, right? And I think with many of these conversations, I'm expecting people to come in and go, well, but Chris, it fits under this, or it fits under that, or it fits under this. And more than happy to be wrong and to continue the conversation. I can't imagine this is the last podcast we'll have about rage, right?
Yeah.
But the fact that, I've spent maybe the past 4 or 5 years asking any mental health professional I got my hands on, whether it was a training student, a physician, our colleagues when they get together, and saying, why don't we diagnose rage? I have yet to get a good answer.
Yeah.
What I get most of the time is, we don't have a diagnosis for rage.
Yeah.
And so my hope is that people have reactions and comment on it and give us feedback about what they think about it.
Yeah, it's brilliant. It would be so interesting to be able to hear how other therapists have experienced rage and what their response to it was in session when there hasn't been a diagnosis and what their go-to diagnosis is.
And their go-to interventions.
Yeah.
Right? Because I
Yeah.
think that's, we didn't even talk about so many things, right? Like what would be in the list of diagnoses or the list of symptomatology for a rage disorder. What does that look like? Does it look different for a feminine version of rage and a masculine version of rage?
Yeah.
Does that need to be sort of sorted out? And if we diagnosed it, how would we treat it?
Yes.
What would we do? And would we do things that are different now? Earlier, when I said there's no medication for rage, that's a fascinating point of view.
Yes.
Right?
Yeah.
We have antidepressants, we have anti-anxiety meds, but how many people would take an anti-rage med if it existed?
Yeah. Yeah.
Right? But again, because there's no disorder, there's nobody looking for the biochemical soup that makes rage.
By being able to develop a diagnosis then only opens the conversation to ways that we can address and treat it in the psychological community.
Yeah.
Yeah.
So interesting conversation. Hopefully people liked it. Let us know what you think and like, comment, and share. That's what I'm supposed to say, right?
I think so.
All right. Take care, guys.